Good afternoon, everyone. Thank you for coming for this press conference. This marks the end of the marathon meeting, which was taking place here at Harare International Conference Center. It started yesterday on the 15th and ended this afternoon. And we are grateful that you've been here since the beginning. But however, there will still be issues which you would need to understand as the media so that you can run with the issues correctly. Once you understand the issues, you will help us market ICASA better. So at this particular moment, I want to hand over to the ICASA 2023 director, Mr. Luke Bodia, to introduce our panelists.
Thank you so much, Madam Edelina, Director of Communication from NAC Zimbabwe. First of all, before I introduce myself, I would like to introduce my president. Mr. President, please.
Yes, thank you, Luke. My name is David Parirenyatwa. I'm the president of SA and ICASA. And on my left is a board member.
Thank you very much. My name is Dr. Amy Chesire from Kenya, a board member of SA. Thank you.
Another board member. Hello, bonjour, je m'appelle Dr. Aliou Silla, je suis secrétaire général de la SA, board member.
My name is Rawaira Mike Chirenje. I'm the chair for the scientific committee and professor of obstetrics and gynecology, University of Zimbabwe. Thank you.
Okay. Good afternoon, everyone. My name is Tajuddin Oyewale. I'm the UNICEF representative in Zimbabwe, and UNICEF is very committed to this conference. Thank you.
Good afternoon. I'm Jane Kalweo. I work with the Joint UN Program on HIV, which is the Secretariat, and we support the national HIV response in the country.
Thank you. Good afternoon, everyone. My name is Abigail Musemburi. I'm the officer in charge for UNFPA in the country, and we are also a co-organizer to ICASA. Thank you very much.
Okay, good afternoon all. You have seen the panel. We have the co-organizer and also the government of Zimbabwe here. We also have most of the best scientists that we know in Africa here, the chair of the scientific committee here. And I can tell you that this upcoming conference that we call ICASA will be one of the best. It's the 22nd edition, but will be one of the best. Let me introduce myself. My name is Luke Bodia. I'm from Benin Republic. I'm director of the conference and also the coordinator of Society for AIDS in Africa. I will hand over to the chair of the conference, ICASA president.
Thank you very much, Luke. We have been having a strategic meeting to plan for ICASA 2023, which will be between the 4th of December and the 9th of December. And we have called it a marathon meeting because this was our final meeting and we covered every possible issue that may arise with regard to ICASA 2023. The ICASA is planned in such a way that SA, the Society for AIDS in Africa, who are the custodians of ICASA, work very, very closely and together with the government of Zimbabwe. The chairperson of ICASA 2023 is myself, and the vice chairperson of ICASA is the Minister of Health for Zimbabwe, in this particular case, Dr. Douglas Mombeshora. Now, we are certain that after this meeting, we are so confident that we will have such a very successful ICASA this year, and preceding that, we'll have two high-level meetings, one which will be organized by the First Ladies, spearheaded by the First Lady of Zimbabwe, which will be looking at elimination of HIV from the mother to the child. That's going to be a high-level meeting, which will be on the 2nd of December. At the same time, there will be another high-level meeting on the same date in Victoria Falls, organized by ICASA, but for the ministers of finance, to look at domestic financing in the health sector, particularly for HIV and AIDS. We in ICASA look at HIV, we look at TB, we look at malaria, we look at other infectious diseases, including COVID-19 and other infectious diseases. So we leave it up to you now to expand. If you've got any questions, any queries, then we can respond to yourselves. Thank you.
Thank you, Mr. Chair.
Thank you so much. Africa is one. What we saw here in the introductions is what we do in Manicaland, that we just don't say, you start from the end to the next one, to the next one, until you get to the end again. So now that the president has spoken, you saw that with the introductions, no one person would introduce anyone, but individually, so that we all are participants to the discussion. The brief has been made by the president. I'm sure from the journalists you would like some issues clarified. So I'll ask you to show by raising your hands so that we know that you want to ask a question. That would help. Where do I start? Yes, NRTV.
All right. Thank you very much. My name is Dorcas Mufiri. Dorcas Mufiri from NRTV. I was following some of the proceedings of the meeting that you had, and we realized that Zimbabwe has come out as one of the countries with the best abstracts. What does it mean for the country's response to HIV? I don't know if I can ask all the questions at once. My second question will be Botswana will be hosting a satellite session. I heard from the representatives from Botswana on male engagement, and Zimbabwe is also running with the same. There's this sudden interest in males regional, and why?
Thank you for that question. So I think your question is essentially saying Zimbabwe had very good abstracts, and what impact will that have in terms of control of HIV in Zimbabwe, if I get you correct? So what we have to appreciate here is right from the onset of HIV in Zimbabwe, there's been a massive investment by the Ministry of Health. In fact, NAC, which is holding this event, if you look at the history of NAC, it was the initiation of the government of Zimbabwe to levy tax on Zimbabweans to form NAC. That's a massive approach which other countries have had to follow. And the pillars, I know the chair here, when he was a Minister of Health, Dr. David Paranyatwa, I can recall when he was talking about the ABCs of HIV prevention. They may sound little, these are massive gains we've had. So as a result of implementation of prevention, treatment of those living with HIV so that they have undetectable viral load. In fact, if you look at this study, uninfected equal to in other words, a person who has got viral control cannot infect another party. You equal to you. All those studies were done in Zimbabwe, right? In partnership with other countries, but the study called HPTN 052, led by the late Professor Hakim, I'm talking about the control of HIV. That's part of the agenda, that these abstracts are coming from those kind of studies. So you can see the impact is that Zimbabwe has one of the highest rates of people living with HIV who are on antiretroviral treatment and are living with controlled viral control. So that impact is going to go on. And like the chair said, when we meet in Victoria Falls with the First Lady and other team members, again, is to make sure that we eliminate pediatric infections. And we have plenary speakers coming in, who are well experienced in that. So we are hoping when we all gather, the results of ICASA will translate into policy, because we're talking first level science, evidence-based science, which will go back into programs and control HIV by 2030. But thank you again for that question.
We'll ask the board member to respond to the male engagement issue.
Okay, thank you very much. I would like to respond to the issue around the satellite sessions on male engagement. I wish to say that the world over, when it comes to the HIV response, you'd find that the health-seeking behavior of men is usually lower than that for women. If you go to statistics and find out even those who seek to know their HIV status, the men are always, the statistics show that the percentage of men is lower. Number two is that when we are to address some of the key issues, and I'll speak on elimination of mother-to-child transmission, we cannot say it's a woman issue because it's the mother who is carrying the baby, but also we need partnership of the husband. So we need the male to be engaged to support the women. If the woman is, for example, taking medication, the man should know so that he should be able to support. Number three is that men in the African society are always the decision makers in our communities, mostly in Africa, perhaps also in the world over. So if we get more men to be engaged, more men to be involved, more men to have knowledge, that might take us to close to ending AIDS by 2030. Remember that in the policy making, you find that the higher percentage of policy making or decision makers in most of our countries are men. So if we engage them, they should be able to understand and know about the HIV response, and they should be able to make decisions at that higher level, which can lead us into ending AIDS by 2030. I thank you.
You wanted to add something?
No, I don't want to add anything. I just want to see, because we have also in the panel here, we have also the UN system, and that question has been dealt with very well with our board member. But I want to see how the UN system are the reflection of the UN system here, all the US agency, on the past, on the just concluded marathon meeting, and the state of preparedness. They should address it to us so that we can, the journalists also can understand where we are, because we just finished ICASA, we just finished the last meeting of ICASA, a preparation meeting. We call it marathon meeting. And it would be good that we should, the UN system should reflect on the marathon meeting and the state of preparedness of this conference in country.
Can I start here?
Thank you, Luke. I think the is a deliberate question to the UN. Maybe I will start by saying that as the UN in Zimbabwe, we congratulate SAR for organizing ICASA in Zimbabwe. We also congratulate the government of Zimbabwe for hosting this very important conference. First part for us as the UN is that this is a very critical area of work because the AIDS epidemic is not gone. And coming out of COVID, there is the risk that we may forget HIV. So really bringing that back to life is highly commendable, and the UN would like to commend the organizers, all those who submitted abstracts, as well as the team that was here for the marathon meeting, who did a very good job in working through the different abstracts and coming to clear decisions. The second is that as the UN, we are co-organizers, and in Zimbabwe, but also globally, meaning at our regional and at our headquarters level, we've reorganized ourselves in a way that we can really support this conference. We believe that the opportunity that the two pre-conference offer is really unique, bringing focus to elimination of HIV transmission from mother to children, and also bringing focus to domestic financing. These are key element of sustainability. The different tracks of this conference speak to different aspects of work, but I think on behalf of us, we would like to underline 2 or 3 key population groups that has been targeted. I think women and children, extremely very important, and we've seen a lot of focus in those areas. The second is the young people. We see a lot of focus on young people, and you know that the highest proportion of new infections is happening in young people, and we are very happy that that is happening. And thirdly are the key populations, and which we also have an opportunity through the community work to address. I will end by saying, as the UN, we welcome the desire by SAR to expand the thinking on that is going to be happening in ICASA beyond HIV, because infectious diseases and the whole public health arena is becoming challenging. And I hope that the proposals emerging from this marathon meeting around harmonization, around how we can better improve quality of abstracts, but also support to young researchers will be taken forward. And I'm sure as the UN will be more than happy to support in that direction. I'll ask my colleagues in UNAIDS and also UNFPA to add. Thank you.
Thank you, Taj. Before I answer Luke, I just wanted to say in terms of male engagement, men are a focus group that we really need to look at. They are in terms of services, they test very late. Even when they test, they do not access treatment on time. And when they get treatment, they do not adhere to the treatment. So when you look at the HIV statistics in the region, especially East and Southern Africa, you find that the mortality, the data on mortality has a picture of men. So we need to focus on men. And I'm glad to say there's been a big effort at the regional level to make sure that we are looking at our programs and they are friendly to men in their diversity. In terms of the UN family, I just want to say we are 11 co-sponsors, 11 agencies. We are represented here, UNICEF, UNAIDS, and UNFPA, but there's WHO, we have UNDP, we have UN Women, we have ILO, we have UNHCR, we have WFP, and maybe I've forgotten, and UNESCO. And all these are very proud to support ICASA over the years, both at the country level, at the regional level, and globally. And that support is starting now. Some of our colleagues are here, but we are here at the country level. At the country level, we are very excited with with what we see, because for us as a UN family, we are very excited that ICASA is happening in Zimbabwe. We know Zimbabwe's capacity because we work here, and we know that it's going to be a very successful ICASA. The commitment is tremendous from the highest level to the community. So we are very excited about that. We are also excited that that communities are going to play a central role. You could hear their voices when we were here. We liked that very much, because the theme for World AIDS Day this year is that communities have to be the center and they lead. So we're excited that this ICASA is also giving, as always, the position of communities. We are also very excited. I want just to echo what Tajuddin has said and agree what we had also said, that the themes are very relevant. We've got a few years to end AIDS as a public health threat by 2030. But as a continent, and I want to agree with what the president said, we have to look at HIV and all in its diversity and how the other diseases and how they interact. And I'm very excited to see the themes, especially the plenary sessions of ICASA are a picture of the key issues we need to be dealing with. And then the sessions and the entire program is looking at what is current and what's relevant and what the continent needs to do to end AIDS as a public health threat. So thank you. We applaud the SAR Secretariat for organizing well. We applaud Zimbabwe for hosting such a good meeting, the final meeting, excellent program, and the participants were here, and we're very pleased to be as a UN family. Thank you.
Okay, thank you very much, my colleagues Taj and Jane. I think they've said most of the things, but again, I really would like to echo the congratulations to the government of Zimbabwe. And also to you, Mr. President, I think for just steering us along to make sure that this is a success. Riding on the 2015 success, I think what we've got and what we saw in the last 2 days has been exceptional, where there were some key decisions that were made around what we need to do, how we're going to hold our plenary sessions, which speakers to have. And as a UN family, I think we are so, so happy to see that there's been that deliberate effort to choose the speakers and to have those thematic areas that really have an impact when we move forward on policy that's really going to help Zimbabwe and Africa as a whole. Let me just home in on the male engagement aspect. We're quite pleased that the community is playing a central role. The conversation this morning, I think, was phenomenal. It really shows that the community wants to play a big role. When it comes to male engagement, I think we really, as a UN agency, we and agencies in broad terms, we're really looking at not just engaging the male when they are older, but we also want to start influencing them when they are younger, so that as they grow up, they are going to make those key decisions that are well informed. But to end this, I really would like to congratulate the government of Zimbabwe and to say well done, and we really look forward to yet another very successful ICASA conference in December. Thank you very much.
Let me just conclude by saying that ICASA is the largest HIV conference in Africa. It's not only HIV, it is, as my president says, TB, malaria, and also emerging diseases that we are addressing during this conference. And we are expecting a minimum of 8,000 delegates here, that we arrive in Harare. So far, we have 450 speakers, presenters, that are accepted to come. And it's also very important to know that we receive more than 2,600 abstracts, during this conference. And it's also very important to also note that we receive more than 1,500 applicants for scholarship. And the last point is that we have to understand that this conference is not only for the paid participants. I'm calling upon all the youth in Zimbabwe and all over Africa to come and attend ICASA and to especially be part of the community village program. Thank you so much.
We're pleased, we're happy, and we urge Zimbabweans to come and attend ICASA 2023.
Thank you very
Zimbabweans.
much.